A phlebotomy technician is preparing to collect blood from a patient who often faints during venipuncture. What is the safest first step? A. Perform the draw while the patient stands. B. Have the patient lie down before starting. C. Ask the patient to look away from the needle but stay seated. D. Continue normally without adjustments. Answer: B. Placing the patient in a supine position minimizes the risk of injury if they faint during the procedure. This proactive step not only protects the patient's safety but also allows the phlebotomist to proceed without rushing due to sudden dizziness. During a draw, the blood stops flowing after the first tube fills. What should the phlebotomist do first? A. Remove the needle immediately. B. Switch to the other arm without trying adjustments. C. Force blood into the tube manually. D. Slightly adjust the needle's position in the vein. Answer: D. Slightly repositioning the needle can re-establish flow if the bevel has pressed against the vein wall. Removing it prematurely can cause unnecessary discomfort and multiple punctures. When collecting blood cultures, which bottle should be filled first? A. Anaerobic. B. Aerobic. C. Either one, order doesn't matter. D. Always only one bottle. Answer: B. Aerobic bottles are filled first because they are less susceptible to contamination from air exposure during collection. This order helps ensure accurate results for identifying bacterial growth. A patient with a bleeding disorder requires venipuncture. Which needle size is best to minimize trauma? A. 18 gauge. B. 21 gauge. C. 23 gauge. D. 16 gauge. Answer: C. A smaller needle, such as 23 gauge, causes less stress on fragile veins and reduces the risk of excessive bleeding. This is particularly important in patients with compromised clotting ability. A phlebotomist notices two different spellings of a patient's name on the requisition form. What should they do? A. Use the spelling on the ID band only. B. Ask the patient to verify and confirm identity with another identifier. C. Choose the most common spelling and proceed. D. Proceed if the birth date matches. Answer: B. Using at least two identifiers ensures correct patient identification and prevents mislabeling. Confirming with the patient directly resolves discrepancies before any sample is collected. Where should a heel stick be performed on a newborn? A. Center of the heel. B. Medial or lateral plantar surface. C. Arch of the foot. D. Anywhere soft on the heel. Answer: B. The medial and lateral plantar areas avoid contact with bone and nerves, reducing injury risk. Using the center or arch can cause serious complications. A blood specimen for ammonia testing should be handled by A. Keeping it at room temperature. B. Placing it in a warm water bath. C. Chilling it in an ice slurry immediately. D. Exposing it to sunlight. Answer: C. Ammonia is unstable at room temperature and must be kept cold to preserve accuracy. Immediate chilling stops metabolic activity that could alter results. While drawing blood, a patient feels tingling and burning in the arm. What should the phlebotomist do? A. Continue and finish quickly. B. Withdraw the needle immediately. C. Ask the patient to ignore it. D. Switch to a larger needle. Answer: B. Tingling or burning indicates possible nerve contact, which can cause lasting injury. Stopping immediately prevents further damage and pain. What is the maximum time a tourniquet should remain on before venipuncture? A. 30 seconds. B. 5 minutes. C. 3 minutes. D. 1 minutes. Answer, D. Keeping the tourniquet on longer than 1 minute can lead to hemoconcentration, which skews lab results. It also increases patient discomfort and vein pressure. Which additive is in a lavender top tube? A. Sodium citrate. B. EDTA. C. Heparin. D. Potassium oxalate. Answer, B. EDTA binds calcium to prevent clotting, making it ideal for hematology studies. This preserves cell morphology for accurate analysis. A patient's arm shows a large bruise where a venipuncture was attempted earlier that day. What is the best site for the next draw? A. Directly over the bruise for stability. B. Above the bruise in the same arm. C. Opposite arm, away from bruised area. D. Hand vein on the same arm. Answer, C. Drawing from the opposite arm avoids further trauma and reduces the chance of collecting hemolyzed blood. Bruised areas may also be more painful and yield inaccurate test results. Which step must be done immediately after removing the needle from a patient's vein? A. Apply the label to the tube. B. Engage safety device and apply pressure. C. Shake the tube vigorously. D. Ask the patient to stand up. Answer, B. Activating the safety device prevents accidental needle sticks, and direct pressure minimizes bleeding. Labeling should always be done after ensuring the patient's safety. For a patient in isolation for airborne disease, the phlebotomist should wear A. Only gloves. B. Gloves and gown. C. Gloves, gown, and N95 respirator. D. Gloves, gown, and surgical mask. Answer, C. Airborne precautions require respiratory protection like an N95 mask to prevent inhalation of pathogens. Full protective gear also protects against contact contamination. A specimen for lactic acid must be A. Chilled and collected without tourniquet application longer than 30 seconds. B. Kept warm during transport. C. Collected after the patient has exercised. D. Left at room temperature for 1 hour before testing. Answer, A. Lactic acid levels can be artificially elevated by prolonged tourniquet use or muscle activity. Chilling preserves the sample for accurate measurement. A patient refuses a blood draw after the phlebotomist has prepared equipment. What is the correct action? A. Persuade them until they agree. B. Proceed if the test is urgent. C. Respect the refusal and document the incident. D. Ask another phlebotomist to attempt. Answer, C. Patient consent is required before any procedure. Proper documentation ensures legal compliance and communicates the situation to the care team. When performing a finger stick, what is the correct way to collect the first drop of blood? A. Wipe it away with gauze. B. Immediately collect it in the capillary tube. C. Let it fall directly into the test strip. D. Allow it to dry before collection. Answer, A. The first drop often contains tissue fluids that can dilute the specimen. Wiping it away ensures a more accurate sample. During venipuncture, what is the recommended angle of needle insertion for an antecubital vein? A. 15 to 30 degrees. B. 45 degrees. C. 60 degrees. D. 5 degrees. Answer, A. An angle of 15 to 30 degrees allows smooth vein entry without going through the opposite wall. Higher angles increase the risk of deep tissue injury. Which patient is most at risk for iatrogenic anemia from frequent blood draws? A. Healthy adult male. B. Newborn in NICU. C. Middle-aged woman. D. Athletic teenager. Answer B. Newborns have a smaller total blood volume, so repeated draws can cause significant blood loss. Minimizing sample volume is critical for these patients. A specimen for glucose testing is drawn into a gray top tube. What additive does this tube contain? A. EDTA. B. Sodium citrate. C. Lithium heparin. D. Sodium fluoride and potassium oxalate. Answer D. Sodium fluoride prevents glycolysis, preserving glucose levels, while potassium oxalate acts as an anticoagulant. This combination ensures accurate glucose measurements. When should a phlebotomist perform hand hygiene during a multi-patient blood collection round? A. At the start of the shift only. B. Between each patient contact. C. Only after visible contamination. D. Every 3 hours. Answer B. Hand hygiene between patients prevents cross-contamination and protects both patients and staff. It's a cornerstone of infection control practices. While labeling tubes at the bedside, the patient tells you their date of birth doesn't match the one on the label. What should you do? A. Correct the label before sending the specimen. B. Ignore it if the name is correct. C. Continue and report later. D. Proceed without labels. Answer A. Mismatched patient information must be corrected immediately to prevent misidentification errors. Accurate labeling at collection time is a safety requirement. A phlebotomist is collecting a stat potassium sample. Which factor could falsely elevate the potassium result? A. Prompt centrifugation. B. Hemolysis from rough handling. C. Immediate refrigeration. D. Using the correct gauge needle. Answer B. Hemolysis releases intracellular potassium into the plasma, creating falsely high readings. Gentle handling preserves cell integrity. For a patient with a PICC line, the phlebotomist should A. Draw directly from the line without permission. B. Only use peripheral venipuncture unless instructed otherwise. C. Always flush the line before drawing. D. Avoid drawing blood entirely. Answer B. Peripheral draws reduce the risk of line infection and complications. Use of central lines requires explicit orders from the healthcare provider. Which step helps prevent backflow during venipuncture? A. Keeping the patient's arm raised above heart level. B. Avoiding excessive vacuum. C. Using a butterfly needle. D. Ensuring the patient's arm is fully extended and tube held below sight. Answer D. Positioning the tube below the site uses gravity to keep blood flowing outward. Backflow can contaminate the vein with additives. Which of the following is an example of a pre-analytical error? A. Incorrect test performed in lab. B. Patient misidentification at collection. C. Using wrong units in result entry. D. Incorrect reagent storage. Answer B. Pre-analytical errors occur before testing begins, such as identification mistakes or wrong collection techniques. They are preventable with proper protocol. What should be done if a patient is wearing a thick coat and refuses to remove it for venipuncture? A. Draw through the coat. B. Politely explain the need to access bare skin and find an alternative site. C. Use the wrist without asking. D. Decline to perform the draw entirely. Answer B. Clear communication about the procedure's requirements usually helps gain cooperation. Bare skin ensures sterility and proper vein location. If a tube is underfilled in a coagulation test, the most likely consequences: A. accurate results. B. No effect on results. C. Shortened clotting time. D. Prolonged clotting time due to excess anticoagulant. Answer: D. Underfilling changes the blood-to additive ratio, affecting coagulation pathways. This can produce falsely prolonged clotting times. A patient is on IV therapy in the right arm. Where should the phlebotomist collect blood? A. Distal to fore site on same arm. B. Proximal to fore site on same arm. C. Opposite arm. D. From the fore line. Answer: C. Drawing from the arm without fore fluids prevents dilution of the blood sample. If unavoidable, special procedures are required. When using an evacuated tube system, what ensures the tube fills correctly? A. Inserting the needle bevel up. B. Using a tube before its expiration date. C. Keeping the tube upright. D. Pulling blood manually. Answer: A. The key to ensuring the evacuated tube fills correctly is inserting the needle bevel up, which allows smooth vein entry and maintains blood flow for proper vacuum filling. Which of these should be done after collecting a bilirubin specimen from an infant? A. Keep in a warm water bath. B. Wrap in foil or place in amber tube. C. Shake vigorously to mix. D. Leave in direct light. Answer: B. Bilirubin is light sensitive, and exposure can cause degradation. Protecting the sample ensures accurate test results. A phlebotomist must collect a fasting glucose, but the patient has eaten. What should they do? A. Collect anyway and note the meal. B. Reschedule per facility policy. C. Ask the patient to vomit. D. Delay without informing anyone. Answer: B. Eating invalidates fasting tests, so rescheduling ensures result accuracy. Documentation and communication prevent wasted testing. The bevel of the needle should face: A. Upward during vein entry. B. Downward for deeper penetration. C. Sideways to reduce pain. D. Any direction, it doesn't matter. Answer: A. Bevel up positioning allows smooth vein entry and minimal tissue damage. This standard technique improves patient comfort. If a patient experiences syncope during a draw, the phlebotomist should: A. Continue quickly. B. Stop the procedure and ensure safety. C. Stand the patient up immediately. D. Leave to get help without securing the patient. Answer: B. Safety is the top priority. Stopping prevents injury from falls. Monitoring and calling for help follow immediately. Which action reduces risk of hemolysis in capillary collection? A. Excessive squeezing of the finger. B. Using a large lancet unnecessarily. C. Mixing with force. D. Allowing blood to flow freely into the container. Answer: D. Gentle collection preserves red cell integrity. Excess pressure can rupture cells, leading to erroneous results. A patient has an above-the-elbow amputation on the left arm. Where is the best site for venipuncture? A. Left upper arm. B. Left hand. C. Right arm. D. Anywhere convenient. Answer: C. The intact right arm is preferred for both safety and ease of access. Amputated limbs may have altered circulation and anatomy. For cold agglutinin testing, the specimen should be: A. Kept at body temperature until processing. B. Chilled. C. Frozen. D. Left at room temperature. Answer: A. Cold agglutinins clump at low temperatures, so maintaining warmth preserves accuracy. This may involve transporting in a warm wrap. Which order of draw is correct? A. Blood cultures, SST, light blue, lavender. B. SST, lavender, light blue, blood cultures. C. Light blue, blood cultures, SST, lavender. D. Blood cultures, light blue, SST, lavender. Answer, D. The correct order minimizes cross-contamination of additives between tubes, which can alter results. Which step comes immediately after identifying the patient? A. Apply tourniquet. B. Sanitize hands and put on gloves. C. Label tubes. D. Select tube color. Answer, B. Hand hygiene and PPE prevent contamination and maintain infection control from the start of the procedure. If a patient is on anticoagulant therapy, extra care should be taken to A. Apply extended pressure post-venipuncture. B. Use larger gauge needles. C. Avoid labeling tubes immediately. D. Always use a syringe method. Answer, A. These patients are prone to prolonged bleeding. Applying longer pressure helps form a stable clot and prevent hematomas. A specimen arrives in the lab unlabeled. The phlebotomist should A. Label it with the most likely patient's info. B. Return it for recollection. C. Test it to avoid waste. D. Store it until identification is confirmed. Answer, B. Unlabeled specimens are rejected to ensure patient safety and test validity. Proper recollection is the only acceptable option. A patient complains of severe pain during venipuncture but insists on continuing. The phlebotomist should A. Continue until finished. B. Loosen tourniquet only. C. Switch tubes to speed up. D. Stop immediately and assess site. Answer, D. Sudden pain may indicate nerve injury or vein trauma. Stopping prevents worsening damage. Patient comfort and safety come first. What is the first thing a phlebotomist should do if exposed to blood via needle stick? A. Finish the procedure. B. Wash the area with soap and water. C. Report at end of shift. D. Cover with a bandage only. Answer, B. Immediate washing reduces pathogen exposure risk. This is followed by reporting and medical evaluation. Which tube is used for coagulation studies? A. Light blue. B. Green. C. Red. D. Gray. Answer, A. Light blue tubes contain sodium citrate, which preserves coagulation factors until testing. A patient's veins are difficult to palpate. Which technique can help? A. Tapping vein hard. B. Applying tourniquet for 5 minutes. C. Warming the site gentle. D. Using larger needle. Answer, C. Heat causes vasodilation, making veins easier to find. Excessive tapping can damage vessels. If blood cultures are ordered with other tests, they should be collected. A. Last. B. First. C. After lavender tube. D. Any order. Answer, B. Collecting cultures first prevents contamination from other additives or handling. Which action ensures accurate capillary blood gas results? A. Delay transport. B. Use large gauge needle. C. Store at room temp for an hour. D. Seal collection device immediately. Answer, D. Sealing prevents air exposure, which could alter gas measurements. Prompt delivery to lab is also essential. What is the safest way to handle a tube that may break during centrifugation? A. Hold it during spin. B. Use a safety-capped rotor. C. Wrap it in gauze. D. Spin without balancing. Answer B. Safety-capped rotors contain breakage, preventing injury and contamination inside the centrifuge. Why is order of draw important? A. It saves time. B. It reduces patient pain. C. It improves vein visibility. D. It prevents additive carryover affecting tests. Answer D. Additives can alter subsequent tests if drawn out of order, leading to inaccurate results. What is the correct action if a patient begins to have a seizure during venipuncture? A. Hold the patient still. B. Remove the needle and protect from injury. C. Continue to finish quickly. D. Restrain arms and legs. Answer B. Safety is the priority. Stopping the procedure and ensuring the patient is safe prevents harm. Seek medical help immediately. For which reason should a heel warmer be used before infant heel puncture? A. Increase blood flow for easier collection. B. Reduce crying. C. Sterilize the skin. D. Numb the area completely. Answer A. Warming dilates blood vessels, producing a stronger blood flow and reducing the need for multiple punctures.